Hello everyone, this video is for the upcoming FMGE exam, and we will just gonna cover up the most important and the most commonly asked topics from the antihypertensive drugs, okay, or the most commonly asked drug and what is the mechanism, what they actually ask, okay. I have recently cleared my FMGE exam and I thought that I am qualified enough to suggest you that what to study and what to not study. So let's just begin. So first, because I have did it, so you can do it too. So let's begin. This is, for example, 1 minute. Yeah, in antihypertensive drug, there is clonidine. This clonidine, they can ask that it is alpha 2 agonist. Only that much they can ask. Another one is this doxazosin. See, this Joshin drug, this means ending. Joshin is for alpha 1 blocker, okay, and this alpha 1 blocker has what? It has good effect on what? Lipid profile. Then comes the beta blocker. The ending, these drugs end with lol, and basically they decrease the renin. Then comes the hydralazine drug. See, hydralazine drug are used in case of the emergency treatment of the hypertension, in case of the pregnancy. But before using hydralazine, we should use this labetalol. Then we can go for the hydralazine. Okay, so use in case of pregnancy, but there is one side effect they usually ask, that is the systemic lupus erythematosus. Okay, then comes another one, that is the nitroprusside. The nitroprusside has the side effect that it can cause the cyanide poisoning, but the treatment can be, then we can give for the cyanide poisoning, that is hydroxycobalamin. Okay, then they can ask that, for example, minoxidil or like diazoxide or the hydralazine, these drugs cause the potassium, these are the potassium channel opener, they can ask this. Then comes this topical minoxidil. Minoxidil is used for the hair growth. So for example, it's used in the case of treatment of alopecia. 2% is used in female, they can ask, and 5 to 10% used in male, they can ask. Then comes this like diazoxide. These are diazoxide, these used in case of treatment of insulinoma, okay, a tumor of insulin where there is excessive release of insulin, okay, but it can cause the, like, this drug side effect is that it can decrease the insulin release, they can ask. Then comes the drug which act on RAS system. Before that we will just cover it, that what they are asking. Okay, so for example, this RAS, what it will do, that will increase the BP. RAS increase the BP, okay. So if we just give the RAS inhibitor, they will decrease the BP, okay. That means the treatment of hypertension. So there's side effect that they can lead to hyperkalemia. That means more potassium in the blood, okay. Now this beta blocker which end with the lol, the drug's name is like lol, for example, like carvedilol, okay. So basically they do what? They are like a renin production inhibitor, okay. They can ask that, tell me the drug which can inhibit the renin production. So these are the beta drugs, okay. Then there is direct renin inhibitor which directly inhibit the renin, they can also ask this, okay, which directly inhibit the renin production. Then comes the AC inhibitor which end with pril, for example captopril, okay. These are like these are the AC inhibitors. What exactly they do, that they will inhibit this process. These usually ACE, what they will it will do, it will convert the angiotensin 1 into angiotensin 2, but this process is inhibited when we are inhibiting the ACE. So AC inhibitor can also be used in case of hypertension. Then comes, there are some potassium sparing diuretic, for example spironolactone, that will inhibit the aldosterone and in a way help in the case of hypertension. Then comes the ARBs, which the drug ended with the sartan, okay. Then they can ask, like for example, remember guys to see by yourself, because they ask this question, so you remember to just see it once, because it helps in memorization, that its mechanism of action is, okay, where it is acting. Now comes this enalkiren. This enalkiren is actually the direct renin inhibitor, they can ask. Then comes this pentopril. I have already told you that pril word, okay. That pril is what? The pril is AC inhibitor. The penopril is a long acting, whereas the captopril is a short acting. They can ask which is long acting, which is short acting AC inhibitor, okay. And the side effect of these prils are like they can cause the cough. Most common side effect is they can cause the dry cough, hence in asthma they should never be given, and they can cause, rarely the side effect they cause is angioedema. They can also increase the bradykinin, hence they are never to be given. They are contraindicated in case of pregnancy or if there is bilateral renal artery stenosis. And why they are contraindicated in pregnancy? Because they are causing the CNS or the renal agenesis, right. Now this one, Let's say this one, that is telmisartan. The telmisartan is ARBs. I have already told the drugs ended with sartan are ARBs. Okay, so these are used in hypertension, and ACO inhibitors are also used in hypertension. Remember one thing, that they are also, these sartans are also used in 1 minute. Yeah, they're also used in case of diabetic nephropathy, chronic kidney disease, MI, and heart failure. It's mean that these sartans are nephroprotective. They can ask that which antihypertensive drug can be nephroprotective. We can say that it is the sartan. Then another drug, that is losartan. The losartan can show antiplatelet effect and uricosuric activity. That means it can decrease the platelet, and it can decrease the uric acid. They can ask this one also. Then comes to telmisartan. The telmisartan in actually helpful in case of diabetic mellitus. Okay. Another one is the calcium channel blocker. So calcium channel blocker, basically these calcium channel blocker, they block the L type of calcium channel, okay, which are basically present in the heart and in the blood vessels. And these calcium channel blocker drug end with the dipines, okay, and they are used in case of like hypertension, angina, or antiarrhythmia. They can use as an antiarrhythmic drug. Remember one thing, that for antiarrhythmic we can use diltiazepam also. And just to remember this dil means heart, right? So as an antiarrhythmic we can use this diltiazepam, or verapamil can also be used. Then comes this nicardipine. The nicardipine is actually, dipine is calcium channel blocker. I have already told dipines. Okay, nicardipine is a drug of choice in case of hypertension emergency. And nifedipine is also a drug of choice in case of tocolytic, when we want patient uterus to get like lytic, okay, that means to relax the uterus. Okay, then comes the nimodipine. The nimodipine is a cerebroselective. They can ask you which calcium channel blocker is cerebroselective, that is nimodipine. And it used to reverse the compensatory vasoconstriction which happens in ischemia case after the subarachnoid hemorrhage, that means in the brain subarachnoid hemorrhage when there is, okay, and after that there is ischemia and there is vessels constriction, that these vessels constriction due to the compensation to this subarachnoid hemorrhage, that time for reversing that we can use this nimodipine. Then another, these side effect of calcium channel blocker, that they can cause reflex tachycardia. They can also cause the constipation. For example, verapamil can cause constipation, and amlodipines are like, they have a side effect, they can cause the pedal edema. Then one key feature we all should know, that the blood vessels, for example, in the blood vessels, if there is vasoconstriction, if the vessels are constricted, the pressure will rise, hence BP will rise. BP will rise, the baroreceptor will act in the heart, and the heart rate will decrease, and hence BP will decrease. Vice versa, when in the blood vessels, the vessels are dilated, BP will, there will be less pressure, so BP will decrease. Then the baroreceptor will act, and what will happen? The heart rate will increase, hence the BP will increase. Then comes the hypertension with comorbidities. So basically, for example, if the patient is hypertensive and plus with that patient has diabetic mellitus or chronic kidney disease, we're gonna use AC inhibitor or ARBs. For example, if the patient is having hypertension, with that the patient is having angina or previous MI or hyperthyroidism or migraine or an anxiety or this one tremor, then you're gonna use beta blocker. For example, means any one of that with hypertension. For example, the patient is present with hypertension as well as the osteoporosis. We will gonna use the thiazide for the treatment of the hypertension to save the calcium. For example, if the patient is having hypertension, with that the patient is having the heart failure, we will gonna use the beta blocker or AC inhibitor, ARBs can be used. For example, if the patient is again present with hypertension and the patient is present with hypertension, BPH or dyslipidemia, we will gonna use alpha-1 blocker, that is Zosyn. For example, if the patient is present in hypertension, with it is present with the Raynaud disease, we can give the calcium channel blocker. Suppose the patient is present only with hypertension, no comorbidities, then we're gonna use A, B, C, D. Yeah, you are right, but B we will not gonna use on hypertension. If without comorbidities, we'll not gonna use B. We'll just use A, C, D. Okay. AC inhibitor, ARB is usually used for the young patient with less than 55 years, whereas the C means calcium channel blocker. D is diuretic, which we use when the patient is older than 55. Thiazide diuretics we use. These are for hypertension only. Another case is resistance hypertension. They ask, so focus here. So when a drug, we have given for example 3 drugs of hypertension, but they are not enough for the treatment, still there is hypertension rise in like BP still is there, hypertension is persistent. So that means that this hypertension is resistant to drug. So this is the resistance hypertension. For the treatment, we can add the fourth drug, that is spironolactone, because the spironolactone is a drug of choice. Another one is the pulmonary hypertension. There we'll just gonna use the, like they ask which drug you are using, and they ask which drug you will use, and they will ask this one mostly and most commonly, and from the past year they are asking this one, that is sildenafil, for which comes by the Viagra. It has another purpose also, but they are using in case of but can be used in case of pulmonary hypertension also, or it can be associated with pulmonary hypertension also. Hope you like this video. Thank you.